Introduction. Clopidogrel, sold under the brand name Plavix among others, is an antiplatelet medication. It is used to reduce the risk of heart disease and stroke in those at high risk. Clopidogrel is also used together with aspirin in heart attacks and following the placement of a coronary artery stent, dual antiplatelet therapy. It is administered by mouth, with effects starting about 2 hours after intake and lasting for 5 days. Common side effects: headache, nausea, easy bruising, itching, and heartburn. Severe side effects: bleeding and thrombotic thrombocytopenic purpura. Its safety during pregnancy is uncertain, though there is no evidence of harm. Belongs to the thienopyridine class of antiplatelets. Works by irreversibly inhibiting the P2Y12 receptor on platelets. Patented in 1982 and approved for medical use in 1997. Listed in the World Health Organization's list of essential medicines. In 2022, it was the 47th most commonly prescribed medication in the United States, with over 13 million prescriptions. Available as a generic medication. Medical uses: prevention of heart attack and stroke in people at high risk, including history of myocardial infarction, acute coronary syndrome, stroke, peripheral artery disease. Recommended treatments by the American Heart Association and the American College of Cardiology. For myocardial infarction with ST elevation, a loading dose is given before percutaneous coronary intervention, PCI, followed by 1 year of treatment for vascular stent recipients. A loading dose before fibrinolytic therapy continued for at least 14 days. For non-ST elevation, myocardial infarction, or unstable angina, loading dose and maintenance therapy in patients receiving PCI who cannot tolerate aspirin. Maintenance therapy for up to 12 months in medium to high-risk patients choosing non-invasive treatment strategies. Stable ischemic heart disease. Monotherapy with clopidogrel is a reasonable option for patients unable to tolerate aspirin. Combination therapy with aspirin in certain high-risk patients. Prevention of thrombosis after coronary stent placement when used with aspirin. As an alternative to aspirin for people intolerant to it. Available in a fixed-dose combination with aspirin. Efficacy. A meta-analysis found a 25% reduction in cardiovascular death, myocardial infarction, and stroke in smokers. Only an 8% benefit was observed in non-smokers. Special recommendations: preferred over aspirin in people with gastric ulceration history, as aspirin can exacerbate the condition. In healed ulcers, aspirin plus proton pump inhibitor, PPI, esomeprazole, showed lower ulcer bleeding incidence compared to clopidogrel. Prophylaxis concerns. Using clopidogrel with PPIs after acute coronary syndrome may increase adverse cardiac outcomes, potentially due to CYP2C19 inhibition affecting clopidogrel activation. The European Medicines Agency issued a public statement on this interaction. Several cardiologists have raised concerns about the limitations of these studies and whether the interaction is real. Adverse effects. Serious adverse drug reactions. Thrombotic thrombocytopenic purpura. Incidence of 4 per million patients treated. Hemorrhage. Annual incidence may increase with co-administration of aspirin. Cure trial results. Acute coronary syndrome without ST elevation, treated with aspirin plus either clopidogrel or placebo for up to 1 year. Any major bleeding, clopidogrel, 3.7%, placebo, 2.7%. Life-threatening bleeding, clopidogrel, 2.2%, placebo, 1.8%. Hemorrhagic stroke, clopidogrel, 0.1%, placebo, 0.1%. Capri trial results, clopidogrel monotherapy versus aspirin monotherapy for 1.6 years in patients with recent stroke or heart attack. Gastrointestinal hemorrhage, clopidogrel, 2.0%, aspirin, 2.7%. Intracranial bleeding, clopidogrel, 0.4%, aspirin, 0.5%. Itching, seen more frequently with clopidogrel than aspirin. No difference in the rate of non-bleeding adverse events in the CURE trial. Rashes and itching, uncommon, 0.11% of patients. Serious hypersensitivity reactions, rare. Interactions. Low interaction potential. Combination with other blood clot affecting drugs, for example, aspirin, heparins, thrombolytics, showed no relevant interactions. Naproxen. Increased likelihood of occult gastrointestinal bleeding, potentially applicable to other NSAIDs. CYP2C19 metabolism. Cellular models suggested clopidogrel may increase blood plasma levels of phenytoin and tolbutamide, but clinical studies showed this mechanism is practically irrelevant. Proton pump inhibitors, PPIs. FDA warning, November 2009. Use caution with omeprazole or esomeprazole. Pantoprazole appears to be safe. Prasugrel, a newer antiplatelet agent, has minimal interaction with omeprazole, esomeprazole, and may be a better alternative when these PPIs are necessary. Pharmacology prodrug. Clopidogrel is metabolized in the liver into its active form. Mechanism of action, specifically and irreversibly inhibits the P2Y12 subtype of ADP receptor, which is critical for platelet activation and cross-linking by fibrin. Pharmacogenetics, CYP2C19. Enzyme plays a critical role in the metabolism of clopidogrel and drugs like antidepressants, barbiturates, PPIs, antimalarial, and antitumor agents. Variants in CYP2C19 can reduce clopidogrel metabolism and efficacy. FDA boxed warning, 2010. Poor metabolizers of CYP2C19 have lower active metabolite levels, reduced platelet inhibition, 3.58 times greater risk of major adverse cardiovascular events like death, heart attack, or stroke. Mutations affecting efficacy. Variants such as CYP2C192, CYP2C193, CYP2C92, CYP2C93, and CYP2B6*5 result in reduced platelet inhibition and clinical efficacy. Poor responders exhibit diminished antiplatelet effects. Additional genes, mutations in CYP3, A4, CYP2C9, CYP2B6, and CYP1A2 may also affect clopidogrel's clinical efficacy and safety. Pharmacokinetics. Absorption and distribution. Rapidly absorbed after a 75 mg oral dose. Peak plasma levels, approximately 3 mgl, occur approximately 1 hour post-dose. Absorption is at least 50%, as indicated by urinary excretion. Pharmacokinetics are linear within the 50-150 mg dose range. Protein binding, clopidogrel, 98%, reversible. Main circulating metabolite, 94%, reversible. Effective food. Food does not significantly modify clopidogrel's bioavailability. Elimination. Following an oral dose, tilde 50% is excreted in urine and tilde 46% in feces over 5 days. Metabolism activation. Clopidogrel is a prodrug activated in 2 enzymatic steps. CYP2C19, CYP1A2, and CYP2B6 convert it into a thiolactone. CYP2, C19, CYP2C9, CYP2B6, CYP3, A produce the active form. The active metabolite has 3 critical stereochemical sites: C4, R configuration, inferred from prasugrel studies, C3, C16, double bond, Z configuration, C7, S configuration. Active isomer. Only 1 of 8 isomers is active as an antiplatelet. Mechanism. The active metabolite forms a disulfide bridge with the platelet ADP receptor, irreversibly inhibiting it. Elimination. Half-life, active metabolite, 0.5 to 1.0 hours. FDA warning, 2010. Clopidogrel may be less effective in people with poor metabolic activation. Mechanism of action. The active metabolite of clopidogrel specifically and irreversibly inhibits the P2Y12 subtype of ADP receptor. The P2Y12 receptor plays a crucial role in activating platelets and their cross-linking by fibrin protein. Platelet inhibition can be observed 2 hours after a single oral dose of clopidogrel. The onset of action is slow, so a loading dose of 600 mg or 300 mg is recommended for rapid effect. Society and culture economics market reach. Clopidogrel is marketed globally in nearly 110 countries. In 2009, Plavix achieved sales of $6.6 billion. In 2007, it was the second top-selling drug globally, with sales increasing by over 20% that year. U.S. sales in 2008 reached $3.8 billion. In 2010, Clopidogrel generated over $9 billion in global sales. Patent history. Clopidogrel was one of the top-selling drugs before its patent expired. In 2006, Apotex, a Canadian pharmaceutical company, briefly marketed generic Clopidogrel. A court order halted production due to a patent infringement case filed by Bristol Myers Squibb. The court upheld Bristol Myers Squibb's patent, protecting it until November 2011. The FDA extended patent protection by 6 months. delaying generic competition until May 2012. In May 2012, the FDA approved generic versions of Clopidogrel.